Blood pressure is a very, very common medical problem and usually is a silent disease for most patients, although it is a major cause of cardiovascular disease, meaning it causes lots of heart attacks, strokes, kidney problems, heart failure. So it's often nicknamed the kind of silent killer. Most patients will have no symptoms at all. Some patients may present with headaches. Even if their blood pressure is very high, people often don't know about it. So over time, high blood pressure causes blood vessel damage, which leads to disease. It's probably the biggest, or it is the biggest preventable cause of death worldwide. In the UK, they think around 1 in 2 strokes is caused by high blood pressure and probably 1 in 4 heart attacks. On the good side, treating blood pressure generally is quite straightforward through lifestyle changes or medication. And by reducing your blood pressure, you cut your risks of these conditions down and all the risks from it. So essentially, blood pressure is usually a silent condition, and we treat it because it prolongs lives and prevents downstream, disease and illness. Yeah, I think another point worth making is that for patients with raised blood pressure, you may be asked to check more initially. So I think standard advice may be to check your blood pressure twice a day for a week or so, just to get a real idea of the readings over a period of time. And again, in some cases, people have something called a 24-hour blood pressure, which is usually done through pharmacies, but maybe done through your doctor or cardiologist, where you would wear a machine for a full 24-hour period, which gives lots of readings day and night. And that's actually quite gold standard to give information about what your blood pressure is doing throughout the day, but also to check that it settles a little bit at night. So lifestyle change is always the first step for anyone with high blood pressure, and to see what you can do. And the things that make a huge difference, obviously, is within your diet, reducing salt down. I think the experts say down to, below 6 grams a day maximum. So particularly worth looking at the salt in your diet and just reading ingredients on foods and trying to avoid processed foods. Exercise is excellent in its own right, but also through weight loss. And obviously, trying to get your weight down a little bit makes a huge difference. Even 5 to 10% of weight loss can really make a huge difference to your blood pressure. There is a specific diet called a DASH diet, DASH. And again, that's a specific diet against high blood pressure or to help lower high blood pressure. And it's essentially a healthy diet full of, fruit, vegetables, whole grains, aligns very much with the idea of the Mediterranean diet. And although it's easy to say, things like reducing stress can make a huge difference as well. People often have high blood pressure when they're under periods of stress. So things like, yoga, meditation, exercise obviously helps with stress, and good sleep pattern makes a massive difference as well. So patients often ask this and want to know, in the vast, vast majority of cases, probably 90 to 95% of cases, there is no cause for your blood pressure, which we call primary hypertension. So it just means you've got high blood pressure because of bad luck. Obviously, we know that genetics will have an influence. So there may well be genetic factors for you within, or within your family setup that make you personally more prone to blood pressure. In that small percent of cases, maybe 5 to 10%, there may be an underlying cause, such as, kidney issues or some hormonal disturbances that are causing your blood pressure. And certainly if patients present at a young age, under 40, with a high blood pressure, or there's something unusual going on where the blood pressure is very high or is very hard to treat, then you may well be investigated, as in have specialist tests looking for causes of your high blood pressure so it can be treated. But I think in summary, the vast majority of cases are just essential or primary hypertension, which is just caused as just bad luck, really, in genetics. So for those patients who do need to progress to take blood pressure tablets, there's various main types, and all of them potentially have side effects. Obviously, the main side effect is they lower your blood pressure, which is the effect we're looking for, and that in itself can make you feel a bit dizzy or wobbly, particularly if the blood pressure goes a bit low. So that's certainly something to look out for with any of the blood pressure tablets. And the timing and the dose is really important. Most doctors would start on a low dose and increase slowly, keeping a careful eye on your blood pressure to try and avoid that. In terms of the specific tablets, some of the big groups called the ACE inhibitors like Ramipril can cause a dry cough. That's something to look out for. Some of the tablets in the group called calcium channel blockers. The common one is amlodipine, can cause ankle swelling. Again, not uncommon. So again, something to look out for. Quite often patients take diuretics, which make you wee more. So passing more urine is obviously a common side effect on those. And timing, again, you'd advise patients to take them earlier in the day or not before a long car journey, etc. And then the other big group are beta blockers, which can often, slow your heart rate down, but they can cause sort of cold peripheries sometimes and tiredness. So the tablets are not without side effects. Some male patients also can get erectile dysfunction on some tablets. Again, something just to be cautious on. But essentially, I think it's a very personalised choice. It would depend on your situation, what are the medical problems you have, what are the tablets you're taking, and it's something to discuss with your doctor, just to come to a shared agreement on what to try. And ultimately, there's so many choices that if one type doesn't suit you, you could stop that and try something else to hopefully find something that gives you good blood pressure control without causing side effects. Pregnancy is a special situation, and again, some tablets need avoiding and stopping and changing before pregnancy. So if you've got high blood pressure and you're thinking about getting pregnant, obviously please speak to your doctor or your obstetrician well in advance of that. The other question I think you asked was about, why is my blood pressure still high even though I'm doing everything I can? There are sort of rare cases where patients just don't respond very well to blood pressure medication for a variety of reasons. And in those cases, you may end up adding 2 or 3 or 4 types of different blood pressure tablets to try and get the blood pressure under control. Ultimately, for some patients, it's very difficult to control the blood pressure with lifestyle measures and multiple medications, which is listed as something called resistant hypertension. It is fairly unusual, and in those cases, most GPs, I think, would refer to a specialist who may perform certain tests to check there's nothing unusual going on. And there are, a variety of medicines only really initiated by specialists, and there are actually some surgical procedures which can be used, something called renal denervation, which is a small operation around the kidneys, which can be very effective for some patients. So there's lots of options there, and it's very rare not to be able to control blood pressure.